Hello, Dr. Z here. I want to go over some simple range of motion exercises for your cervical spine. Range of motion exercises are important foundational work when you're coming off of an injury or even chronic restrictions in the neck. So when we talk about range of motion for the neck, there's two major planes. We call it rotation, lateral flexion, and flexion and extension. So rotation, you want to make sure you're sitting up nice and straight, almost like someone's taking your head, pulling up to the ceiling. And then you want to slowly turn your head to the left. Hold it there for a few seconds. And slowly turn your head to the right. And I like patients to go back and forth a total of 10 times. Now the whole trick to this is go to the position where it feels comfortable. You don't want to strain it to get those extra few degrees. That's not what we're looking for. We want you to turn your head just to the point where it seems like it naturally ends in a pain-free position. And what you'll notice is the more you do that in a pain-free position, you'll start to get more motion in your neck. But it takes time. So that's the rotation. Lateral flexion is just simply taking your ear to your shoulder. Now, pure lateral flexion doesn't include turning your head. A lot of times people are going to turn their head and force the ear to the shoulder, or even I see patients even bringing their shoulder up. So there's not a lot of pure lateral flexion, but try to eliminate that twisting of the neck or the head. And again, nice, slow, controlled. Take it to the position that you feel comfortable with. And you can kind of see, like when I'm laterally flexing my head to the left, I can feel it. It's a little bit more restricted going to the right. And I'm not going to force it going to the left to try to keep it the same as the opposite side. I'm going to go exactly to the position that my neck is allowing me to go to. So there's your rotations, lateral flexions. And the next one is flexion and extension. Same concept, slow, controlled. You don't want to force this range of motion through any type of irritation or pain. Bringing your chin down, hold it there for a little bit, and then bring it up. I like 10 reps in each position, 10 rotations, 10 lateral flexions, 10 flexion extensions. This is great foundational work when you're looking to even just strengthen an area or come back after some type of an injury. Range of motion is important because if you think about it, like if you're going to be working out your bicep and you want to strengthen your bicep, just like you want to strengthen your neck or strengthen your back, if you don't have the full range of motion, you're not going to accomplish that full strengthening. So say if I have a problem with my elbow and I want to strengthen my bicep, I'm doing bicep curls, but I can only go this far. I'm only going to be able to strengthen my bicep, a certain percentage. But if I got full range of motion in that elbow, I'll be able to maximize the strengthening of the bicep. Same concept with the neck and the lower back. If you get that foundational range of motion in, then we can get into flexibility and strengthening, and you'll be able to maximize your flexibility and maximize your strengthening if that range of motion is accomplished.